That is sternum. What is the last rib which attached directly to sternum? Seventh. Yes. Then it is eighth rib, ninth, and tenth. It is sixth, fifth, and fourth. This line which is passed through middle part of sternum, that is linea mediana anterior, linea mediana anterior. Then it is clavicle, and line which is passed through middle part of clavicle, that is mid-clavicular line, linea medio clavicularis. Between this line and sternum, it is linea parasternalis, linea parasternalis, and it is the same, linea parasternalis, linea media clavicularis. And in axillary cavity we have anterior axillary line, middle axillary line, and posterior axillary line. Now I will draw only mid-axillary line, linea axillaris media, linea axillaris media in axillary cavity, and that is topography of liver. Topography of liver. Superior border of liver. Superior border start in tenth intercostal space and goes upward to the fourth. That is fourth rib. That is fifth rib, sixth, seventh, eighth, ninth, and 10th. In 10th intercostal space, and superior border of liver goes upward to the level of 4th intercostal space in linea media clavicularis. And from this place, it is 5th, that is, it goes to 5th intercostal space on the left side in linea parasternalis. That is superior border. Start from 10th intercostal space in mid-axillary line on the right side, goes upward to the level of 4th intercostal space in linea media clavicularis, and then descend to 5th intercostal space, 5th left intercostal space in linea parasternalis. That is superior border of liver. And inferior border of liver pass at the lower edge of the costal arch, arcus costalis, 10th ribs, then 9th rib, and it cross cartilage of the 9th right rib, goes below of xiphoid process. It pass cartilage of the 7th left rib and finish at the same point in 5th left intercostal space in linea parasternalis. That is inferior border of the liver. It is cartilage of the 9th rib, it is cartilage of the 7th rib, and finish in 5th intercostal space. Not necessary to draw this diagram, but you need to explain superior and inferior border of the liver. Most part of the liver in right hypochondric region, small part of liver in epigastric region. Next diagram, that is pathway of bile. This diagram you need to draw. That is the liver. We have right and left hepatic ducts. They join together and forms common hepatic duct. It is gallbladder and cystic duct join together with common hepatic and forms common bile duct, ductus halidachus. And common bile duct joined with pancreatic duct, ductus pancreaticus, forms ampule, ampulla hepatopancreatica, and this ampule opens into the duodenum in papilla duodeni major. Number 1, right hepatic duct, ductus hepaticus dexter. Number 2, left hepatic duct, ductus hepaticus sinister. Number 3, ductus hepaticus communis. Number 4, gallbladder, that is vesica phalia in Latin. Number 5, cystic duct, ductus cysticus. Number 6, ductus halidachus, common bile duct. Number 7, ductus pancreaticus. Number 8, ampule, ampulla, hepatopancreatica. And number 9, papilla duodeni major, that is descendants part of duodenum, pars descendans duodeni. This diagram you need to know next time, and you should answer. What else? What else? Only this diagram. One diagram you need to draw. What else? That is diaphragm. That is diaphragm. And it is liver. That is the liver. And peritoneum from diaphragm goes to the liver and makes falciform ligament, ligamentum falciformi hepatis. This ligament in sagittal direction separates right lobe from left lobe. In a minute I show it on the curve. And posteriorly the same peritoneum from diaphragm goes to liver and forms coronary ligament, ligamentum coronarium hepatis. Ligamentum coronarium hepatis. And free end of coronary ligament here, and it is the same. This end and this end of coronary ligament, that is triangular ligament, ligamentum triangulare hepatis. That is why diaphragmatic surface of the liver has falciform ligament, coronary ligament, and right and left triangular ligaments. From visceral surface, peritoneum goes to what? Goes to stomach and to the beginning of duodenum, and it makes ligamentum hepatogastricum and ligamentum hepatoduodenale. Together, these two ligaments, that is lesser amentum, amentum minus. That is on visceral surface of the liver. And last moment. In porta hepatis, it is proper hepatic artery comes, and this artery subdivides into right and left hepatic arteries, and they continues into segmentary arteries, goes to segments of liver. Together with proper hepatic artery, in porta hepatis we have portal vein, vena porta. Portal vein, the same subdivides into right and left branch, then into segmentary, then smaller veins and interlobular veins. That is why blood comes to liver through proper hepatic artery, that is oxygenated blood, and deoxygenated blood comes to liver through portal vein. And these two vessels, hepatic artery and portal vein, subdivides in the liver into right and left hepatic, then segmentary, then smaller arteries and veins, and interlobular artery and vein. Then they continues into the lobule, main or anatomical and functional unit of the liver, that is lobulus hepaticus. This lobule separates from nearest lobules with the help of connective tissue, and this interlobular artery and vein join together and continues into sinusoid capillaries, and blood passes through these capillaries and goes to central veins. Central veins join together and makes collecting veins, and collecting veins join together and makes hepatic veins. 4, sometimes 6 hepatic veins opens into inferior vena cava. That is, deoxygenated blood leaves liver through hepatic veins, which inflow into inferior vena cava. And now in liver we have network of capillaries. They are sinusoid capillaries between portal vein and between hepatic veins, which goes to inferior vena cava. That is miracle network of the liver. Miracle network. That is wonderful network of the liver, because network of capillaries take place between two veins, between portal vein and between hepatic veins, which goes to inferior vena cava. And some words about pancreas. Pancreas has triangular shape. It has superior border, inferior border, and anterior border. And it has 3 surfaces: anterior surface, posterior surface, and inferior surface. 2 surfaces, anterior and inferior surfaces, they supplies with peritoneum, but posterior surface of pancreas have not got peritoneum. And we speak about extraperitoneal position of pancreas. Extraperitoneal. Liver has mesoperitoneal position. And pancreas consists of head of the pancreas, body, and tail. Tail of pancreas goes to direction of the spleen, and head of the pancreas surrounds with the duodenum. And the main duct of the pancreas, that is ductus pancreaticus, we already said that it's joined with ductus haledachus, makes ampule and opens into papilla duodeni major. Sometime maybe accessory duct ductus pancreaticus accessorius, which opens into papilla duodeni minor. And pancreas, that is a mixed gland. It's consists of exocrine and endocrine parts. Exocrine gland produce pancreatic juice, and endocrine function, that is production of insulin and glucagon. They regulates level of sugar in blood. What we can